Hello, this is Rashi Sahai and you're watching Medicircle. Today on our cancer awareness series, we have Dr. Geetha Nagastri with us. Dr. Geetha Nagastri is a renowned surgical oncologist in Hyderabad and is currently practicing in Care Hospital. Dr. Geetha Nagastri is the first female surgical oncologist in the states of Telangana and Andhra Pradesh with an experience of over 20 years. Welcome to Medicircle, Dr. Geetha Nagastri.
Thank you, Rasi, for your kind introduction.
So in 2020, more than 2 lakh women in India were estimated to have diagnosed with breast cancer, and more than 76,000 deaths were reported as per the estimates. As per the 2020 National Cancer Registry Program report, the number is expected to rise to more than 2.3 lakhs till 2025. So doctor, can you please tell us what is breast cancer?
A cancer, any type of cancer, tumor which is malignant, arising in the breast is breast cancer. And it can be any type because it can be from the breast gland, it can be from the skin, it can be melanoma, anything. But it is inside the arising from the breast is called breast cancer. And it is most common in women. It is compared to men also has a breast cancer, but women compared to men, women has highest risk, like many hundreds folds than men, the risk factor of breast cancer in women.
Okay, doctor. So what are the major causes of breast cancer?
Like there is nothing like this is a particular cause. You know how cancer occurs anyway. How it is nothing but our own cells. Cancer, tumor or cancer is nothing but our own tumor or cancer is nothing but our own divide cells. Actually, in the nature is so perfect that the cells divide in a perfect manner. That is, there are two genes which control it, proto-oncogene and tumor suppressor gene. These two act in a balance that cell division occurs in a smooth way. If any mutation occurs in these genes, then the cell that they lost the control and they divide uncontrolled. This uncontrolled way of division only is tumor, or some maybe benign or it malignant. Malignant means which has potential to spread to other organs. That is malignant. That is tumor. But there is no particular reason this is the cause for breast cancer. Definitely it has increased breast cancer incidence, especially in India, because breast cancer is known as the disease of the West once upon a time. And it's so rampant, so high. Statistics are saying that 1 in 28 women is likely to get breast cancer in the near future. That is an alarming figure, which we all have to act. The causes being that everything has changed in women's life. Previously, at least in our generation, the age of menarche used to be 14, 15. Now the age of menarche has come down. It is like 10, 11 age of menarche. Age of menopause has increased. In 40, average 45, 48, menopause used to happen previously. Now even 50 to 53 women are menstruating. And number of children have come down. Previously, people used to have 5, 6, 10 children. Is one or none, or two, max 2 children. And number of pregnancies means that protection will be there. The number of children has come down. That is also one of the risk factor. And all the sedentary lifestyles, obesity, we have changed our food habits, westernization has happened, all fast foods and pollution, what we eat, what we drink, what we breathe, everything is polluted. All these are the main reason for increase in breast cancer in general, breast cancer in particular. This woman has increased hormone exposure. Like all we eat or drink or adulterate, all milk we drink, and all chicken, all the non-vegetarian food, all are grown with hormones and all. That hormone influence also is there. Increased years of hormone exposure is there in the woman. That is the reason for increase in women's cancers, especially the breast cancer and gynecological cancers. And we see now the kids are, the teenage girls, actually, so 30-40% of teenage girls are having polycystic ovaries, obesity. This is all the metabolic syndrome. This polycystic ovary initially leads to the delayed periods or irregular cycles, then infertility, then these cancers, breast cancer, endometrial cancer, all these cancers will occur because of this. So there is definitely, we consider breast cancer is definitely a lifestyle disease.
Okay, doctor. So can you tell us about some signs and symptoms of breast cancer?
Yes, actually, signs and symptoms means, yeah, most common is the palpable lump. Some lump will be palpable with the woman. I don't say every lump palpable in the breast is a cancer. Only 20, but we should view every lump with a suspicion unless considered unless proved otherwise. So that we don't miss any diagnosis. Only out of the palpable lumps, only 20% are malignant, 20% are only cancers. Rest 80% will be benign only. But every lump we should view with the suspicion of malignancy, and unless proved otherwise, we should consider as a malignant so that we won't miss the diagnosis. Usually the symptoms will be the palpable lumps, any retraction of the nipple, any blood stain or discharge from the nipple, or any lump in the axilla, any skin changes like pudgy orange appearance of the skin. These are usually the signs of breast cancer. But our aim is that breast cancer, this is the one when the cancer is at the palpable stage. So how to prevent breast cancer, we won't prevent breast cancer, but early diagnosis is the only QT success in the breast cancer. That's the only thing. Whatever medicine, the breast cancer has so much of research, and it is a role model for other cancers, because something comes in the breast cancer, then the other we try in other cancers. So much research happens, and every month, every yearly, so many new drugs comes in breast cancer for the treatment of breast cancer. Whatever research, whatever advancement, or how much ever newer drugs have come, but the key to the success, key to the survival is the early detection, and early detection only. So for the early detection, we have to do mammography, that is screening mammography. We tell those lesions which are found in the mammography, those which are not palpable to our hands, only when we do mammography, that is a millimeter size, sub-centimeter size lesions, they are known as screen detected lesions. Something no screen detected lesions. If you detect some lesions, screen detected lesions which are suspicious, from that we can take biopsy. Nowadays techniques are very good. We can do biopsy, or we can wire localization. We can put a wire in that lesion and excise that lesion and send for the progen section or biopsy. So that is the reason mammography is very screening in breast is very useful. It has proved that it will reduce the mortality. That is, every woman who crosses, actually American Cancer Society guidelines, it is above 45. Every woman has to get screened. But coming to the Indian scenario, India has like average incidence of breast cancer in India is 10 years less than the West. Like their average incidence is 50 to 60, our average incidence is 40 to 50, and we have 30% of breast cancers below 40 years of age. So that is the reason I strongly feel that we don't have that particular guideline, but American Cancer Guideline is 45, but 40 to 45 discussion dialogue with the doctor and can do screening. That is the recommendation. But for Indian women, better we start at around about 40 years only, because our average incidence is 10 years less, and we have much more engaged breast cancers compared to the West. And engaged breast cancers are very aggressive, and early detection is saves the women in their very that age, very productive years of life. That is, that women in that age is they are in productive years of life, where the family is young, children are young. So we had to start screening at 40 years, yearly mammography for women. So that will help to detect, that will help in early detection of the breast cancer.
Okay, doctor. So are elder women more likely to develop breast cancer?
Yeah, actually, not only this, as age advances, the chance of breast cancer, any cancers is increases. So definitely there's a as you grow, because the one reason for they say that what is the reason for the increase in incidence of cancers cancers in general, and but breast cancer in particular. There is one reason is a life expectancy have increased. Previously, when we got the independence, the life expectancy is only 45. Now 70, by 80. So now some of us might not be alive. It is average incidence of average life expectancy that time. But life expectancy have almost more than almost doubled. So the age increase, that is a one reason that the incidence of incidence of cancers have increased, because life expectancy also have increased. And as you grow old, and then cancer incidence also increases. Chance of getting cancer also is high.
So, doctor, can a woman breastfeed her child even if she is suffering from cancer?
If it's suffering from cancer, means, yeah, that is not a
Suffering from breast cancer, you can say.
Yeah, she can suffering from breast cancer is in particular. Once she she's with breast cancer, because once she's diagnosed with breast cancer, she'll be undergoing treatment. Once surgery is over, she can breastfeed. Maybe chemotherapy drugs, while taking chemotherapy, some drugs will be secreted. So that time they can avoid, depending on the what drugs we are giving.
Okay, doctor. So which breast is more prone to cancer?
It is nothing like this breast is more prone to cancer. That in each breast, both breasts are equal chance that they may get breast cancer. That nothing like that. One breast is more prone, and other breast is less prone, and there is no reason for that also.
Okay. Okay, doctor. So on Medicircle, our main focus have always been to provide our audience with large amount of information in less time. And so today we will be conducting a small question answer session in which you can either answer in yes or no, or in 1 or 2 line sentences.
Okay, okay.
So my first question is that, are only women affected with breast cancer?
No, I told you first only, even men has a chance of getting breast cancer, but women has 200 folds more chance of getting breast cancer than men. Men also can get breast cancer.
And can smoking increase the risk of breast cancer?
Yeah, smoking increases the risk of all the cancers. Most of the people think that smoking means only lung cancer, which is the risk. Not like this. Smoking has an effect on lung cancer, stomach cancer, bladder cancer, cervical cancer, even breast cancer.
So is breast cancer surgery quite painful?
No, I don't. That everything has improved over years. Previously, a few decades ago, like 50 years, 60 years back, more than 50 years back, the breast cancer means they used to do whole breast with under muscle, everything they used to remove, and they used to have like swollen hand and all, like filarial hand, like swollen hand and all. Previously, scenario is like that. The radical mass, then modified radical mass preserving the muscle have come. Then the breast conserving surgery has come. Nowadays there's no need to breast cancer is diagnosed also. We don't remove whole breast. We just conserve the breast. We remove the tumor with the adjacent normal tissue, and we'll adjust cosmetically so that it looks like exactly like other breast only. So and small incision, and it like not a major burden like other abdomen surgery and all. It is a superficial surgery for all practical purposes, and women is recover very fast, and next day they'll be up and about they do their own work, and that is not a issue. And there is no, women should remember that they should not worry that breast cancer means they have to forego their breast and all. No need. There's just only tumor with the normal tissue and lymph nodes. Lymph nodes, either if it is a small lesion in node negative on imaging, we take sentinel nodes so that the morbidity, hand edema will be less. If it is some nodes are involved, then we'll do the proper axillary dissection. So this is not a breast conserving surgery. And results also, breast cancer surgery with radiation is almost survival is similar or even more than the mastectomy. Oncological wise also, survival wise also, there is no breast conserving surgery as good as mastectomy.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you. Thank you.